Hi, everybody. I'm here with Dr. Ron Schmid, who's an author and a naturopathic doctor for quite a number of years now. Right, Dr. Ron?
34 years, naturopathic physician, yes.
That's awesome. So we're going to talk today about the fermented cod liver oil scandal that's been going on in this series that I'm doing. But I want to introduce you to people who don't know you, who haven't read either of your books. I've read your book. You were actually one of the people who influenced me, actually convinced me to start drinking raw milk. The Untold Story of Milk, if you haven't read it, I read a lot of books. I probably read two or three books a week. I listen to them as much as I can so I can read more. But I'm an avid reader, and I've read a lot of books, and quite honestly, Untold Story of Milk was up there in my mind with somebody like some of my favorite authors like Malcolm Gladwell. In terms of the quality of writing and the research that you did, and uncovering all this information about the history of pasteurization, the history of the swill milk and the babies who were dying, early in the day, and how this all played out. It was fascinating.
Thank you very much. Thank you very much.
And it really convinced me. After I read that, I was like, these are the facts. There's nothing to be afraid of here. And I started feeding my daughter raw milk and started buying it for our family, and we've had access to it ever since. So, and that's all we drink. So, thanks to you. And your first book, though, came out in, I want to say it was 1987. Is that correct?
That's right. Mm-hmm.
And now you've just republished that book with a lot of changes, and the new title is, tell me the title.
The old title is Traditional Foods Are Your Best Medicine.
Right.
And that went through 4 printings.
Wow.
And the new edition is, we've retitled it as Primal Nutrition, Paleolithic and Ancestral Diets for Optimal Health. And it's a very thorough rewrite. A lot of updating, a lot of things changed in 30 years, and I hope I learned a few things that went in there. And I had some wonderful help from Sally Fallon Morell, who went through the book a number of years ago and marked up the paragraphs and wrote notes in the columns, the margins, and showed me where I made mistakes and showed me where I needed to rewrite and update and helped me with changes. And that was really instrumental in when I went through and did the actual rewrite over the course of the last 18 months or so. That was invaluable. And then Sally wrote the one of the 2 forwards to the book. Nora Gedgaudos, the author of Primal Body, Primal Mind, which is a marvelous, marvelous book that I learned so much from, came out 3 years or so ago, and who's one of our speakers at our upcoming conference, wrote the other forward. So I had a lot of really great help in making the book what it is now, and frankly, it's even better than the Untold Story of Milk. I think
I can't wait. I just downloaded it.
You'll enjoy it.
I just got it on Kindle, so I'm excited to read it. And you know what? I was looking through it, and it turns out we actually are from the same area.
Really?
I grew up in Nyack, New York.
Oh, my goodness.
How crazy is that?
I was born in Nyack Hospital, and when I graduated from naturopathic medical school, I went back to Nyack, and I worked in a practice there a mile from the hospital I was born in for Dr. Michael Schachter, a medical doctor who's 7 or 8 years older than I am and had been in practice for 7 or 8 years and is now another of our speakers at the conference. He's speaking on salvestrols, nature's answer to cancer, natural from organic food, salvestrols isolated. It's going to be a fascinating talk that he's going to do on that. I've known him since I graduated from medical school in 1981. He's an old friend by now.
That's great. That's great. Okay, we're going to get into this because people want to know. They want to hear your story. There's a lot of scandal, a lot of rumors flying around. Things are crazy, but that's why I want to get you on video to have you really share with us what happened to you. And what you went through. It's just kind of a big deal. And I read it on your site, Dr. Ron's website. You had it on the front page of your site for you probably still do.
Yeah, there's a link to the article. It was called "Too Much of a Good Thing" for quite some time, and then I changed it to "Too Much of a Not So Good Thing" when Kaayla's report came out.
Okay, so we're going to hear about that. So it's about cod liver oil. It's about fermented cod liver oil. And let's go back in history, because for those who didn't read your story or haven't heard it, you have been taking cod liver oil. You're actually, I wanted to mention this. Did they, in your book, your new book, and the old book, but now new book,
Yeah.
were you calling it a caveman diet back in the day in the 80s?
Well, when I went to work for Dr. Schachter in 1981, when I graduated from medical school, I started seeing a lot of his patients, a lot of the practice patients there, for nutrition. They really discovered Weston Price. Dr. Schachter and his partner at the time discovered Weston Price through me. So I went in and started seeing people and putting them on Weston Price type diets, and they would do really, frankly, incredibly well. People recover from all kinds of supposedly incurable things when they follow carefully the dietary principles that I teach, that I've learned from Weston Price. And Dr. Schachter started calling it Ron Schmid's caveman diet. And he and Dr. Schenk and the other doctor there said, well, why don't you write it up? Please put it on paper for us so we can give it to our patients. And I said, well, I can't, because there is no diet. There's a different diet for every person. It's a set of principles that I use, that I've extracted from diets that Weston Price studied all over the world. Everybody needs a different diet. A different time in their life, they need a different diet. And as they evolve, they change, and the dietary needs change. They even change from day to day. So I'm sorry, but there is no Dr. Ron's caveman diet. Well, they still called it Ron Schmid's caveman diet, but eventually, when I first wrote Traditional Food's Your Best Medicine, that's when I really first explained the principles that I learned from Dr. Price and Dr. Pottinger and Sir Robert McCarrison and Pritikin and macrobiotics and the Scarsdale diet. I mean, you get pieces in a lot of different places, and the trick is to extract what you see as truth from each of many different places and put it to work and see what works and what doesn't work and what changes, and evolve a diet out of that. So my diet today is really an evolution of what came day by day and month by month and year by year for the last 35 years or so.
So, but it turned out you had a pretty huge, almost deadly. You had 3 to 6 months to live. You were pronounced.
Well, yeah, and it's kind of, if I was eating so well, how is it that I got so sick?
Right.
That's a really good question. And, the answer really is that if I hadn't been eating so well, I would have got very sick even sooner, I believe. But in a nutshell, I took Carlson cod liver oil from 1979 when I was in medical school until 2001. And I typically took, my patients did so well on it that I upped the dose to a couple tablespoons a day, and I typically took 2 tablespoons a day.
And that was from, you said 79 through 2001, you took Carlson's.
Yeah, I mean, it wasn't the same every day. Sometimes I took 1, sometimes I took 2, but I took it just about every day. I was very disciplined, and I was convinced that it was a wonderful food, a great thing to be taking. And of course, when I got involved with the Weston Price Foundation at its very beginnings in 1999, back then, the website talked about 1 or 2 tablespoons a day, and Sally Fallon recommended high doses, and I took high doses. A lot of people took high doses, and there really was never any problem with that. Now, Dr. Price always recommended low doses, a teaspoon, a half a teaspoon, but back in his day, most of the cod liver oils were rancid, and that's probably, and he warned about that, particularly in relation to heart disease and kidney disease. That's probably why he recommended such low doses. But at any rate, I took very liberal doses for some 25 years. I switched over in 2001 to the blue ice Norwegian cod liver oil, which I continued to take until 2006. And then the fermented cod liver oil came out, and I began to take the fermented cod liver oil. And again, a couple tablespoons a day, typically. And sometimes once a week or so, I might take 3 tablespoons. I kind of bought into talk of how the Norwegian fishermen had a barrel of cod liver oil and livers fermenting outside their doorway, and they'd take a big scoopful every time they walked by. Those kind of stories circulated via Green Pasture back then, and the Price Foundation continued to recommend large doses, particularly orally, telling people that if they were stressed out, they needed to take more, and a couple of tablespoons or 3 tablespoons a day was appropriate. And I had no reason to doubt that, so I took substantial doses. I averaged a couple tablespoons a day, starting of the fermented cod liver oil, starting in 2000, late 2006, early 2007.
Okay.
And I started to develop problems that I attributed to. I'd had a bout with Lyme disease back in 2002, pretty much recovered, still had a little fatigue here and there and a mild symptoms of Lyme occasionally, but 95% recovered. But I had persistent shortness of breath and some fluid edema in my legs, which of course are symptoms of heart disease, of heart failure. But I, being my own doctor at the time and being arrogant enough and foolish enough to think that I kind of knew it all, I thought, well, no, it didn't even occur to me that I might have heart disease, that heart failure, congestive heart failure. And I assumed my problems were related to unresolved issues with the Lyme disease. That got worse and worse over the course of 3 or 4 years, from 2008 to 2012, when my symptoms were so bad that I couldn't get up out of the chair and walk across the room that I'm in now without being gasping for breath. I had trouble going upstairs. I was carrying an extra 25 pounds or so of fluid, edema in my legs and abdomen. And finally, I'm not going to go into the whole story here, but I finally went to the hospital and found myself some doctors, and was immediately diagnosed with advanced heart failure and liver failure. Desperate, thinking it was due to the Lyme disease somehow, and that the doctors there really didn't even acknowledge not Lyme disease. They said, you don't have Lyme disease anymore, you have heart failure. Of course, I accepted I had heart failure. It was pretty clear, but I thought it was due to the Lyme disease. And
because you're just trying to process all this. You're just trying to, how could this even be true?
I wasn't processing very well because my brain, I mean, if you don't have enough oxygen to breathe right, you don't have enough oxygen for your brain either. So when people start acting irrationally and they're taking fermented cod liver oil, you've got to kind of wonder about how their brain is functioning. But at any rate...
that was 2012 when they diagnosed you with advanced...
Pardon me?
The diagnosis was advanced
heart failure. I was seen by the heart transplant team at Yale New Haven Hospital. My cardiologist is a world-renowned electrophysiologist, does pacemakers and so forth. I had very bad arrhythmia, rapid heartbeat, super high pulse, abnormalities in the size of my heart, murmurs because the heart was too big for the valve, so the blood was leaking between chambers.
You said you had like an enlarged heart?
Enlargement, yeah. Well, the heart was enlarging in order to try and get the job done. I wasn't getting enough oxygen around to the tissues, and as it turned out, the cells in the heart were dying, so the heart was hypertrophying to try and make up for the death of cells.
Wow.
And, I was a mess. I was really, really a mess.
And you
my wife Ellie says I had a blue streak down the middle, right across my nose, down the middle of my face, and the blue, of course, is cyanosis from lack of oxygen.
Oh my
God! And I was bad, and I was so arrogant. Really, is the word. I thought I knew so much that the medical doctors weren't going to help me with my quote Lyme disease, and I was going to deal with it myself. And it really was a change in attitude, kind of turning things over and admitting to myself that I didn't know anything, and that I really had a lot to learn from other people, and letting the doctors that I had lead me, in a way to let them help me with the things that I very much needed help from the medical profession. Really, there were drugs that I needed at the time and testing to find out what was going on. And I spent 11 days in the hospital, and it's really for when a doctor is that sick. You go, and of course, you're used to seeing other people come to you for help with various things, and especially not knowing the first few days, not knowing what had gone wrong. So when I talk about all this at the conference, I'll tell how I discovered what was wrong, and my desperation really changing to joy, knowing that since I knew what had gone wrong, I would be able to figure out what to do and how to work together with the doctors and nurses to get me through the acute crisis and out of the hospital without a pacemaker or getting online for a heart transplant, and actually begin my recovery, which began with stopping taking cod liver oil. And the whole story of how at first I thought it was just too much cod liver oil, but then when I kind of asked myself, gee, I took this amount for 25 years, didn't have any problems. Why did I start to have problems in 2008 or so? And gradually the problems had gotten worse. And then the story of, Kaayla coming to me in Indianapolis last year with suspicions about fermented cod liver oil that other people had also. And I wondered,
But at that time, you weren't suspecting the fermented cod liver oil. You thought it was just that you were taking too much.
Yeah, well, and I thought too, I had some people, we sold it to people from 2006 till 2 months ago, and I was an enthusiastic supporter. And when Kaayla told me her suspicions, I was concerned, but also curious, and I really. I helped her with the lab testing. I helped to pay for it, and I was behind her all the way. But I hoped that it would be exonerated. I hoped that it would show that there were no problems with it, and that we were selling a good product. And that really, I have a certain amount of guilt that I didn't examine things sooner, that I didn't question sooner what I had accepted, and that I really had neglected to do the kind of homework I should have. But be that as it may, then the story unfolds that Kaayla will tell too. But when she did get the results from the 9 independent labs all over the world, Europe and the United States, and we started to look at the results, and she wrote up her special report, and I actually read the special report in the weeks before it was published, the earlier drafts, and as soon as I saw what the conclusions were and what the test results showed, I immediately pulled the products from our website and immediately offered a refund. I said I suspected that there were problems, and I would have more information once I read the report that we were no longer selling green pasture products, and then subsequently we began to offer refunds to everyone who had purchased from us and who still had product either.
How long did you offer the refunds?
Pardon me?
How long did you offer the refunds?
Well, we still do. People who have unopened bottles that they purchased after July 1st.
So it's a huge loss it's got to be a huge loss for you. I know you actually dumped it. You didn't even try to sell what you had, is what I heard.
No, well, we returned it to Green Pasture.
Did you get a refund for that?
Refund for what we returned.
Okay, good.
Although we're still returning things to them, and we'll see about that. But no, they were responsible about making refunds.
But you did say, Ron.
I'm sorry.
Well, I didn't mean to interrupt, but you did say that it's a 20% loss in your revenue from not selling the cod liver oil, the fermented.
Green pasture products were about 20% of our total sales, and so we dropped 20%.
That's significant.
Yeah, and we have a small kind of family-oriented organization. My brother-in-law and sister-in-law built the company. Ellie and I, it was just my wife and I the first 4 or 5 years, and then her sister joined us, and brother-in-law and 2 of my nephews work for us, and we have a couple other employees who are kind of like family side. didn't want to lay anybody off, and we haven't. We'll build our business back, but it was the only thing to do. Once I understood, we weren't gonna sell it anymore, and it was very clear to me. I mean, there's been all this controversy about, well, one lab says one thing, one lab says another, and we'll all learn more about that at the conference as we go through that. But the labs Kaayla chose were independent labs, and the labs that Weston Price and Green Pasture continually cite are really cherry-picked labs that and scientists that give the results that the interpretations of results that the interested parties want. So it's clear to me that the world's leading lipid scientists say that this is the most rancid oil they've ever seen. And certainly my understanding of what Dr. Price had to say about cod liver oil and what I've seen, not only in myself, but in other people who have come forth with their stories about health issues when they were taking fermented cod liver oil, has convinced me that it's doing serious damage to many people.
Wow. So it takes a lot of guts to stand up, but based on your story, I can see why you did what you did. If I were you, and I think most people, I would hope most people, if they went through what you went through, 11 days in the hospital, like literally facing death, I'd have a hard time believing that somebody wouldn't say, I don't think ethically I can sell this anymore. Because how could you not, I don't know how you wouldn't connect the dots. Okay, I guess
I didn't.
Yeah.
I mean, but in all fairness, I didn't connect the dots for 3 years until Kaayla wrote her report. I had such, it's a trust. And I think a lot of people are experiencing now what I experienced then. I trusted David Wetzel and I trusted Sally Fallon to be recommending good products. And it really didn't dawn on me that it could be something that was particularly wrong with fermented cod liver oil. It seemed to me that it must have just been that I took too much cod liver oil. And of course, frankly, Sally Fallon has used that to paint me as the, what do they call it, the poster boy for stupidity. I wish I wasn't so stupid when she was writing forwards to my book, but I was the poster boy for stupidity because I took too much cod liver oil. Well, I took cod liver oil pretty much commensurate with what a lot of people took. Although I was so disciplined and using 2 or 3 tablespoons a day, starting in 2006 of the fermented cod liver oil, I suspect that it was proportional. I mean, a lot of poison is worse than a little poison. You can have somebody who's eating a great diet and their lovely wife starts slipping a little bit of arsenic in their food, and they might not notice a thing for 6 months or a year, and then gradually up the dose. And of course, if the dose is bigger, toxicity builds up, and all of a sudden one morning you wake up and you think, I better take some food to the lab and see what's going on.
Somebody brought up the issue of the baby formula, and I think I mentioned this to Kaayla when I did the interview with her, that the baby formula, when you think about how much there is, and they're eating that formula all day, the Weston Price baby formula, if you are using the fermented cod liver oil, the babies are getting a lot.
Well, I saw the figure of even if they're only getting a half a teaspoon a day, that's the equivalent of a couple tablespoons in a 150-pound person.
Wow.
Exactly. And we have had stories of birth defects and other problems in children, problems in pregnancy, in Amish women who were using fermented cod liver oil and then not have subsequent pregnancies 2 or 3 years later not having problems. And we hear, oh, this is anonymous, where are the names and so forth. Not very many people want to stand up and talk about this publicly with their names attached to it. Look at how I've been attacked and how Kaayla's been attacked, and Dave Gumpert, not speaking about illness, but simply for pointing out really obvious facts about the way the Price Foundation has reacted to this whole thing. And he's ostracized and painted as a terrible journalist and a traitor to the cause of honest journalism. And bull like that. So.
So the answer to people saying you just took too much, when you read the report, I want to dig into that, because when you read Kaayla's report, how did you then know? Because she's a scientist, you're a doctor. I mean, you guys aren't like hippies or whatever. Like, you know, you're not just like random people that don't have any training and understanding of science and medicine and nutrition. You read this report, and what then did you conclude? How did you then conclude that it was the fermented cod liver oil that was the rancidity that caused your heart disease? Oh, we just lost. There we go. We're back. That it was...
It was pretty easy, really, to conclude that fermented cod liver oil was the problem. I had taken regular cod liver oil for 25 years and not had any problems. I began the fermented cod liver oil in 2006, and by mid-2008, I was starting to have the symptoms that gradually increased, got worse and worse over the next 3 years, 4 years of shortness of breath and edema, fluid buildup, symptoms of heart failure. And in retrospect, once I discovered that it was heart failure when I was hospitalized in 2012, it was obvious that it had only begun when I started to take fermented cod liver oil. And of course, when Kaayla's paper came out, and I realized that it was rancid, and I put that together with Dr. Price's findings about rancidity in cod liver oil being a huge problem back in the 1930s, and the papers that I discovered from scientists who experimented with mice back in the 1920s and 30s, giving them substantial doses of cod liver oil and finding that they developed the same kind of heart problems that I had. It all added up. It was very obvious at that point what had caused the problem. Plus the fact that I had made, according to my Yale New Haven team of cardiologists, I made a miraculous recovery. That's written in my medical record 6 months ago, that I had made a miraculous recovery from advanced heart failure.
Yeah. So what was so special about, how'd you do that? You stopped taking the fermented cod liver oil.
But that's on the surface. But you know what? Just even at that, I should have, by all rights, according to conventional medicine, I should have died. Advanced heart failure is irreversible. People go, that's why the prognosis was 3 to 6 months. Mm-hmm. People go downhill and die. It's really only the strength of my diet and the principles that I follow that I will be talking about extensively at the conference. That's why I recovered.
Wow. Which is really, there's so many people with heart disease.
That's right. And it's reversible. It's reversible if people are willing to go far enough. You got to be disciplined, and you got to understand what the principles are. And we've learned the principles from Doctors Price and Pottinger and other healers. The principles are there, and they're not all out there right in the Weston Price Foundation.
Really?
Weston Price Foundation is a particular interpretation of Weston Price's teachings, and it's not one that I particularly agree with. They're very heavy on certain foods that I think should be used minimally, or in cases of advanced illness, not at all. There's a real lack of understanding about things that I write about in my book, that Nora Gedgalos writes about in her book, Primal Body, Primal Mind, how insulin operates in chronic disease and what we can do to really thoroughly control insulin levels. Individuality, the way a diet must be individualized according to a person, really their metabolic type, and how that metabolic type changes throughout life, so that the diet must change. All of these factors are highly relevant in understanding how to use dietary principles. I call them the primal principles. How to use them to figure out what to eat every day. That's what it amounts to. And how that changes from one day to the next, week to week, month to month, year to year. It changes. Mm-hmm. I'm almost 70 years old now. The dietary needs that I have now are profoundly different than what they were 20 or 25 years ago, even though the same principles apply.
Well, you look great, I gotta tell you. You really look good.
Well, thank you. It's nice to be here and nice to be anywhere, as I've said since I got out of the hospital.
Wow. And that was 2012, right? When you went into the hospital.
What?
So it's been 3 years?
little over 3 years, yeah. Mm-hmm.
And it's so it was really Kaayla Daniel who had the chutzpah to come forward and really talk to you, because again, it's that cognitive, I can never say this phrase, but cognitive dissonance, where it's really hard for people to. I just did an interview with Kathy Raymond, who also had a health issue, a lot of health issues from this, and it was very hard for her to come to terms with that. And she had very much the same reaction as you, which is, feeling very responsible, personally responsible, which is admirable, and I think it's humble. I really do. But it's interesting to me to look at this and see how many people in this community who are having this experience, and there's probably people watching who've had this different experiences, different health problems as a result. To be able to hear you and to hear Kathy share your stories, I think it's going to empower others to look at their own situation. But it was Kaayla who had the chutzpah and the courage to confront it and to look into it.
That's true, and she really was the first. Other people have stepped forward now, but Kaayla was the first to put the suspicions together and say, whatever the costs are, I have to do something about this. So I had her as an example when it was my turn to stand up and say, no more, and here's what I'm going to try and do to make it right. I had her as an example of someone who had the courage to do that in spades, really, because she had very little to gain, everything to lose. Her income largely depended on the Weston Price Foundation, and here she's willing to stand up and say, well, I've got to speak the truth, wherever the chips might fall. That's real courage. You're quite right.
Yeah, it is. And she has paid a big price, and it's terrible. So, what else do I want to ask you about? I think that was the word that you used when I spoke to you earlier, and I've heard from so many people, which was this phrase, blind faith.
Yeah. And that's, that's probably the most common reaction that people have is how can it be? Mm-hmm. How can it be that Sally Fallon and the Weston Price Foundation would stand up for this product if it's not good? And that's in my case, it was more just accepting it for so long when there really weren't any big questions. I mean, certainly there were people. We had people say they had a kind of a negative reaction to it. They didn't want to take it. They weren't going to take it anymore. It burned their throat and so forth. Or their kids couldn't take it. But the story, nobody really tied together the stories that we hear now of arrhythmias and heart problems and things like that. People weren't, just like I wasn't tying it together. I mean, how could the cod liver oil that the Weston Price Foundation recommended be causing problems? And kind of coming to be able to own it, to own that it was my own fault for not investigating on my own. But how much I'm a physician, and I didn't investigate properly. I don't think that the people who were hurt by this, who suspect that they were now, or quite sure they were, they really can't blame themselves. I mean, because they trusted people that they had every right to trust. Look at how much good the Weston Price Foundation has done in so many areas, and it's always hard for people to accept that that leaders and organizations that have done a great deal for good could simultaneously or at the same time be doing things that were highly problematic. You look at superstar athletes who make millions of dollars a year, and kids worship them, and then something happens, and their character flaws come bubbling out. And it's like, oh, how could you do that to me? You know, and I think there's a lot of that kind of feeling with people. How could my hero let me down?
Right.
But at a certain point, we have to use our judgment and accept that people are fallible and that we all make mistakes, and if we can't have much control over whether other people own up to their mistakes or not, but we can own up to our own and decide we're going to do what we need to do to feel better about how we're handling things.
You met Sally in the late 80s, back when you were starting out. You had your first book come out, and tell us about that. You've been friends with her for...
I met Sally at a I think it was a Cancer Control Society conference in California. The Cancer Control Society has an annual conference, and I spoke at many of them in the late 80s because I treated a lot of people with cancer, and I used elements of the Gerson therapy, and I went to that conference. I spoke at that conference a number of times, and Sally was there. I can't remember in what capacity. It must have been maybe with the Price Pottinger Nutrition Foundation. I'm not sure when her first book, Nourishing Traditions, came out, if it involved that. But we spoke and became friendly, and I would see her at different things like that over the years. And then in 2000, or 1999, 2000, when she started the Weston Price Foundation, I got involved very early. We were not at the first conference, which I think was just a handful of people, but I went to the second conference, and we started sponsoring, and we became gold sponsors early on, around 2003 or 2004, and continued in that capacity. And of course, she helped me with my book, The Untold Story of Milk. She helped really inspire me to write it. I had written Traditional Foods, Your Best Medicine, back in '87, and it had become kind of a standard in the alternative medicine, natural foods community. It was still in print, and she encouraged me to put my writer's cap on again and write The Untold Story of Milk, and helped me in formulating a plan for that and implementing it. And of course, she published it, New Trends published it, and she wrote the introduction. And I stayed at her house in Washington when I was doing my research in the Library of Congress about raw milk, and so we have a long and very, very fruitful and nice relationship that ended when I said that I was not going to back down about fermented cod liver oil.
Can you tell that story, Ron? Can you tell what happened, how that played out?
Well, when I read Kaayla's report, I put on my website that we were no longer carrying fermented cod liver oil and green pasture products, that I had suspicions that it had more to do with my heart problems than I had previously realized. And Sally emailed me, I guess. There were calls, emails, and said, no, if you persist in doing that, you're violating the rule that we have about disparaging another sponsor's products, and you can't do that publicly like that.
Had you ever heard that rule before?
No, but I don't doubt that it was there, and I can kind of, the reasoning behind it was that it's, how would it be if everybody was attacking everybody else's products? But,
right.
Ostensibly, but in a way that seems like kind of a cover. I mean, you don't do something like that lightly. You don't do it without evidence. And her position was, well, bring the evidence to us, the board, her and the board, and we'll deal with it accordingly. We'll evaluate it, and we'll see what we think. Of course, Kaayla had done that. Kaayla had brought evidence to the board.
She did.
Before she ever ordered independent tests. And
what evidence did she bring?
Other people had testing done.
Okay. And
showed Sally that, and they had said, no, we accept our lab. We don't think your lab understands these things, and we have a different interpretation. And literally, we think the textbooks, Wetzel thinks the textbooks need to be rewritten to about what rancidity is, according to the one or two labs that he has that say his products aren't rancid, and that's it. Kaayla has quoted Sally as saying, we want labs that will be fair to Dave, rather than all of the top marine lipid scientists in the world. At any rate, Sally told me that if I didn't remove the references to fermented cod liver oil from my website, that I would be taken from the speaker list. I was supposed to speak about heart disease at the conference, the WAPF conference in November, and we would no longer be gold sponsors. Well, I thought about it. I like to think about things a little bit. I thought about it for a day or so, and I said, no, that wouldn't be right. I hope we can still be friends, and I understand your need to do that because you have certain rules and procedures that you need to follow, but I hope we can still be friends and be open to discussing these issues and just kind of hopefully do quote more independent lab research, and so, which many people were calling for, including David Gumpert in his blog. And Sally said, no, we can't be friends. If you're going to do this, that's it. And that was it. Just boom. And I don't know. Trying to say how I feel about that, but it's hurtful in a way.
It's okay.
But I have no regrets. Things present themselves. I had no idea that we would be forming a new foundation and a conference. That happened,
Suddenly, right?
It's very suddenly, yeah. Well, once I was out, and then Kaayla got kicked out off the board as vice president, and a couple of days after that, I do some started to say I do my best thinking, but maybe what good thinking I do comes in the middle of the night often. But I usually I'm up from 3:30 or so till 4 or 5 o'clock, in an hour or two, and then back to sleep. But I woke up one night and I thought, we need to start a foundation.
Wow.
We need a new foundation because this is not going to change. What Sally's doing now is not going to change, and I need a place to go, and Kaayla needs a place to go, and other people need a place to go. And by that time, Dave Gumpert had been ostracized as well for his blogs, and I talked to David and Kaayla and said, look, let's think about this. Let's think about doing this. And then we started kicking it around together, and within a couple of days, we decided to do what we were going to do, and we got a hold of Kathy Raymond, and she got a hold of you, and I called Nora Degrados and Mike Schachter, and Kaayla called Randy Hartnell, and we called Joan Grinzy, and all of a sudden things were starting to take shape. And thanks to email and the iPhone, we were able to put this together in what would normally take 6 months. We did in really a couple weeks or a month. And I don't know if there are going to be 50 people or 500 at this conference. It remains to be seen, but there's a lot of interest, and as far as I can see, the whole notion of bringing people together from the paleo, primal, and Weston Price communities to celebrate all that we have in common, which really is an understanding that Weston Price was a hell of a person, and that he left incredible wisdom for it. However we choose to interpret that wisdom, we have that in common, that we look to Weston Price for guidance. And after that, do you eat dairy? Do you not eat dairy? Do you eat grains or not? Do you allow coffee on the table? Well, sure. Some people drink it and some don't. And some people are going to have chocolate for dessert, and I might have a beer, and it's all fine. We celebrate what we have in common, and what we have as differences, let's talk about them and learn from each other instead of ostracizing each other. And so this is a very different idea than what's been going on at the Weston Price Foundation. I really learned that. I kind of, in the last few weeks, I really had no idea how many people had been turned off, frankly, by the kind of exclusiveness and the judgmental attitude and the refusal to be inclusive. That is really the way that the Price Foundation has operated for some time, much to their detriment, because there's no reason for that. Maybe I'm an idealist, but I think that we should all be able to get along, and as I say, celebrate our sameness and learn from our differences and grow together. And that's the idea of this community with democratic governance. The whole idea that the membership should elect the board every year, and the board then chooses the officers, and the people have a feedback mechanism, and that we're not going to endorse any products officially. There's not going to be any question of integrity on that. We just won't endorse products. We certainly might give personal advice. People ask us, have things to say, but I think it's important not to be commercial that way. It's part of a democratic governance and openness about what proceedings are and how the board's operating, what the finances are. I mean, all that should be transparent, and that's how we're going to do things. We have had a wonderful offer from Nutritional Therapy Associates, is a sponsor for us now, and they've offered to basically pay for facilitation by a group called Toolbox for Education, which helps facilitate effective leadership in groups that want to do things democratically. Mm-hmm. And they'll be we'll be training with a facilitator, and then their facilitator will actually lead the Sunday morning meeting at which the participants, the people who are there, the sponsors, the speakers, and the attendees will elect the board, and the board will then choose officers with input and discussion from the people that are there. And we hope we can accomplish this in 2 or 3 hours. They say the group Toolbox for Education folks that we talk to say, well, that's a lot to accomplish in 2 or 3 hours, but we've accomplished a lot in 2 or 3 months, and we think we can work together to get that done and give birth to our new organization. I think we had the comment, Kaayla or David or I, one of us said, well, we're the midwives here, but we're going to give birth to something that has a life of its own.
Right. And a legacy. Something
that... Well, yeah, you think about that when you get to be I'm not going to say an old man, but a somewhat older gentleman like myself. You think about what you want to leave behind, and to have an organization that was not going to die off when the dictator dies, rather to create a democratic organization that would have a life of its own and go on when we're gone. I mean, I think David and I and Kaayla are thinking about that. That's what we would like it to be.
Yeah. I just wanted to comment on that issue that you said about the paleo. I definitely saw that. I just wanted to validate what you said, that, that's actually the reason why I'm no longer a member of the Weston Price Foundation. And I've seen that happen to a number of people where, we weren't happy with the way things were going. For me, it was Rob Wolf. When Rob Wolf was trashed publicly a couple years ago, that's when I said I can't pay membership dues anymore to the Weston Price Foundation, because I just didn't think that was fair. I think Rob Wolf has done tremendous work in this arena. I think he's an incredible inspiration. And so to have Sally rip him apart, for me, I just didn't want to be a party to that. Hopefully you'll come back. We lost you. Okay, there you are. Every once in a while you go away. So I just wanted to validate that. I know that there's a number of people who feel that way. And so I'm really excited to have a new organization that we can participate in. And I was gonna, I'll just announce it. So when the Santa Cruz chapter leaders got the letter, and this was in David Gumpert's blog the other day, that a couple days ago, the Santa Cruz chapter leaders is excommunicated too strong of a word? I don't know.
Well, David has used that word, also shunned, as in Amish communities. They were shunned.
They were basically told that they can't use their the Weston Price logo and the Facebook page anymore because they were linking to David Gumpert. And when that happened, I was up early that morning and emailed you and said, are we going to have chapters in the new foundation?
Right, we hadn't thought about that. We hadn't had time to think about it.
I know, because it all happened so fast. So I'm excited.
And the answer is yes, we're doing that now, and that's encouraging people. And Rob Wolf, if you're out there, we hope that you'll get involved with us. And if the board goes for it, I'll certainly suggest that we'd like to have you as a speaker next year. We wanted to invite you this year. I think we tried, but you were tied up, or other things, short notice and stuff. But
so I am going to be the first chapter leader here in LA, and I'm proud to say that, and I'm excited. And I think it makes sense to me, because I just want to say to this that I don't think people are fallible. We all make mistakes. We're all human, absolutely. But I also think we need organizational structures that make it easier for people to not be as fallible. Let's just put it that way. If I had to make all the decisions for, a huge organization, it would be easier for me to make mistakes. It's much better to have lots of input from different people, and have different people vote, and have different people express their opinions. And that's what I saw wasn't happening.
Well, there's a favorite prayer that I like. It's called an Indian prayer, and there's one line in it: "Make me wise so that I may understand the things you have taught my people." So that means that, according to the Native Americans, the Sioux, Oglala Sioux, the essence of wisdom was listening to the things you have taught my people. What do my people have to say? And from that we learn, and we can find the way forward.
That's great.
And we do our share too. They learn from us. We go back and forth, and I try, whenever I do, I'm usually sorry. So I try not to do anything without sounding it off good friends.
Yeah.
First my wife, and then another old friend who's going to be our volunteer photographer, one of the world's great photographers. Wow. Unsung and unknown, doesn't beat his own drum much, but done marvelous work all over the world for the last 40 years, and he will be our volunteer photographer doing the still photography at the conference. And I promise anyone who comes that he will have fantastic pictures of all kinds of people that will be posted on our website subsequently. And then, of course, we have another gentleman who's going to do the film for the video, for our video distribution to people who choose to do video, from a distance. Anyway, we got a tremendous lineup of people who will be there. Really,
it's really exciting.
Fantastic.
So it's November 21st, and we'll put the links down below. If people can't make it, but they want to be involved, they can actually become a founding member by ordering the download package. When you order the download package, it also you get your membership as part of the download package. Mm-hmm. And the download package is the on-demand video. So you're going to get all the videos. You're not going to be able to vote, and you're not going to be there for the Sunday voting. And I don't even know, are they going to film the Sunday vote? Well, we lost Dr. Ron. His iPhone died, and it's after 5. And anyway, I think we're done. Well, it's after 5 on their coast. I think we're done anyway. But I just he wanted to say he hopes to see you all in Southbridge. And I just want to thank everybody for taking the time to watch. And if you have any questions, you can ask in the comments.